Your cat is coughing and you're wondering what's wrong. Is it allergies, asthma, or just a cold? The truth is, figuring out why your cat is coughing requires understanding of different respiratory issues cats can develop. Hi, I'm Lyndall from Vetster, and today we're discussing why your cat is coughing. As usual, all of the information in this video has been carefully reviewed by leading vets to veterinarians. Alright, let's get into it.
When we think about allergies in cats, most people assume they'd show up as sneezing or respiratory symptoms like in humans. But in most cats, allergic reactions actually manifest through skin changes instead. Itchy skin, dermatitis, and excessive grooming are way more characteristic of feline allergic reactions than respiratory involvement. However, there's an important exception. Feline asthma is an allergic respiratory condition. It develops when the immune system overreacts to airborne allergens like pollen or dust. This causes inflammation and narrowing of the airways. Asthma manifests through coughing, wheezing, or labored breathing. But here's something important to know. These indicators may be understated or intermittent, so they're easy to miss. Let's talk about what actually causes respiratory symptoms in cats. The list includes coughing, sneezing, eye or nasal discharge, red eyes or conjunctivitis, an elevated third eyelid, wheezing, and a rapid respiratory rate that persists even during sleep. General illness signs may accompany these symptoms too, like lethargy or loss of appetite. A feline cold is an upper respiratory infection affecting the nasal passages, throat, and sinuses. It creates symptoms like sneezing, nasal discharge, and watery eyes. The main causes of cold-like symptoms in cats involve upper respiratory infections, frequently caused by feline herpes virus or feline calicivirus. Less frequently, cats experience bacterial or fungal respiratory tract infections. Certain cats face elevated risk for respiratory infections. Kittens are vulnerable because their immune systems are still developing. Geriatric cats have weakening immunity. Unvaccinated cats obviously face higher risk. Cats with feline immunodeficiency virus, or FIV, or feline leukemia virus, or FELV, have compromised immunity. Cats living in outdoor environments encounter more exposure. Cats in multi-cat households, shelters, or rescues are at higher risk due to the increased exposure to infected animals. Now let's discuss what feline allergies actually look like. Most commonly, allergies trigger skin inflammation that shows up as excessive scratching, overgrooming, hair loss, miliary dermatitis, which is tiny, dry, scabby bumps, and various rashes. Some cats may develop sneezing, nasal discharge, or red runny eyes from airborne allergens, but this happens rarely. When cats do develop respiratory symptoms through allergies, the presentation typically involves feline asthma. The allergens causing problems include dust, smoke, pollen, and mold spores. The immune system responds to these allergens, causing airway inflammation and respiratory difficulty. Signs include rapid breathing, especially during sleep, breathing difficulty, wheezing, and coughing or hacking. Here's something really important that many cat owners miss. Cats are great at hiding signs of illness. Breathing difficulties from asthma can be surprisingly subtle and easy to overlook. One of the easiest ways to spot increased respiratory effort is to watch your cat's belly. If you see abdominal movement exceeding normal patterns, even when your cat is relaxed, it may suggest your cat is working harder to breathe. Open mouth breathing or panting is a critical emergency that demands immediate veterinary attention. Cats experiencing severe respiratory distress may assume a hunched posture near ground level with their necks extended. This characteristic asthma posture actually helps facilitate diagnosis. Additional factors that can generate respiratory symptoms in cats include irritants like grass-awns, smoke, or essential oils. Trauma to the throat or chest can cause coughing. Polyps or growths in the ears, nasal passages, or throat may cause symptoms. Heart disease can present with respiratory signs. Various types of cancer can affect the respiratory system. Fungal infections cause respiratory symptoms, and pneumonia creates coughing and respiratory distress. Another frequent cause of coughing or gagging in cats is hairballs. Here's the confusing part. Genuine hairballs originate within the stomach rather than the lungs, but the expulsion motions and sounds resemble coughing so closely that they cause confusion. Persistent coughing or gagging without actually producing hairballs may signal underlying respiratory conditions like asthma. The probability of specific respiratory diseases depends on several variables. Age matters. Vaccination status matters. Overall health matters. Lifestyle matters. Kittens, senior felines, unvaccinated cats, and those with compromised immunity face elevated susceptibility to upper respiratory infections. Younger felines face greater viral infection or irritant vulnerability. Older cats experience higher risks for dental disease, cardiac conditions, nasal polyps, or tumors. So how does your vet figure out what's actually wrong? Testing options may include a physical examination, blood tests incorporating infectious disease screening, diagnostic imaging, including radiographs, rhinoscopy, and nasal or oral swab cultures. Emergency symptoms requiring immediate medical attention include difficulty breathing, which encompasses open mouth breathing or panting, a blue or gray tongue or gums, collapse or loss of consciousness, and lethargy. A typical feline cold continues approximately 1 to 2 weeks. If your cat's symptoms persist beyond several days or keep recurring repeatedly, you need to schedule a veterinary consultation. Don't wait hoping it will resolve on its own. When you're ready to discuss your cat's respiratory symptoms with a vet, Vetster makes it convenient. Book a virtual appointment to discuss your cat's coughing, sneezing, or breathing changes. Thanks for watching, and we'll see you in the next video.